Have you ever wondered why so many people fail to detect liver disease until it is already in its late stages? The truth is, the liver is known as the silent organ. Unlike other organs, it often shows no obvious symptoms until the damage has become severe. Every year, millions of people suffer from chronic liver disease, cirrhosis, or even liver cancer, but many of them could have recognized the early warning signs if they had paid closer attention to their bodies. In today's video, we'll uncover 12 silent signs of liver disease that you should never ignore. These signals may seem minor at first, but they are your body's way of warning you that your liver is struggling. Make sure to stay until the end, because recognizing these symptoms early could protect not only your health, but also save your life or the life of someone you love. In 5. Sign 1. Persistent fatigue and weakness. One of the earliest and most common warning signs of liver disease is persistent fatigue and weakness. Unlike the ordinary tiredness we experience after a long day, this type of fatigue is deep, lingering, and often disproportionate to daily activity. The liver is a vital organ responsible for processing nutrients, producing energy, and detoxifying harmful substances in the body. When the liver is damaged, these functions are disrupted, leading to a buildup of toxins and a reduction in energy production. As a result, patients often feel drained even after resting. I once treated a middle-aged man who described his fatigue as like carrying a heavy backpack all the time. Despite sleeping long hours, he woke up exhausted. Blood tests revealed advanced liver disease, even though he had dismissed his fatigue as just aging. What makes fatigue concerning in liver disease is that it tends to progress slowly, and many people ignore it until more obvious symptoms appear. By that time, the disease may already be in an advanced stage. If you or a loved one has been experiencing unexplained fatigue for weeks or months, especially when combined with other subtle signs like poor appetite or weight loss, it may be a hidden signal from the liver. Early recognition is key to preventing further damage. Sign 2. Jaundice, yellowing of skin and eyes. Jaundice is perhaps the most recognizable sign of liver disease, characterized by a yellowing of the skin and whites of the eyes. This occurs when the liver can no longer process bilirubin, a yellow pigment produced during the breakdown of red blood cells. Instead of being excreted, bilirubin builds up in the bloodstream, causing visible discoloration. For patients, jaundice is often accompanied by dark urine, pale stools, and itching. The itching can be particularly severe, disrupting sleep and lowering quality of life. I remember one elderly woman who came to the hospital because her family noticed her eyes turning yellow. She thought it was nothing serious until her tests revealed cirrhosis. That yellowing was her body's desperate cry for help. The danger of jaundice is that many people wait until the yellowing becomes obvious. By then, the liver is already struggling significantly. In fact, jaundice often signals advanced disease or acute liver failure. If you ever notice even slight yellowing of the skin or eyes, especially when accompanied by fatigue, loss of appetite, or weight changes, it's important to seek medical attention immediately. Early evaluation can make the difference between manageable disease and life-threatening complications. Sign 3. Loss of appetite and sudden weight loss. Another subtle yet dangerous sign of chronic liver disease is loss of appetite. Patients often report feeling full quickly, disinterested in food, or even nauseated at the sight of meals. Over time, this leads to unexplained weight loss and malnutrition. The liver plays a central role in digestion by producing bile, which helps break down fats. When the liver is damaged, bile production and nutrient absorption are impaired. Toxins in the blood can also suppress appetite and alter taste perception. I recall a man in his late 50s who had unintentionally lost over 10 kilograms in just 6 months. He believed it was diet success until further tests revealed advanced cirrhosis. His weight loss was not a sign of health, but a symptom of a failing liver. This symptom is especially dangerous in elderly patients. Malnutrition weakens immunity, reduces muscle mass, and increases vulnerability to complications such as infections and falls. The key message is Sudden, unexplained weight loss should never be ignored. If it's accompanied by fatigue, digestive changes, or jaundice, it's vital to check liver function. Sign 4. Abdominal swelling, ascites. A particularly serious warning sign of advanced liver disease is abdominal swelling, known medically as ascites. This occurs when fluid accumulates in the abdominal cavity due to increased pressure in the blood vessels of the liver and reduced protein production. Patients often notice their belly becoming round, tight, or heavy, even without significant weight gain. Some may mistake it for bloating or simple weight gain, but ascites feels different, more like fluid sloshing inside. I once met a patient who said his stomach felt like a water balloon. He couldn't bend easily, tie his shoes, or sleep comfortably. After examination, we discovered his liver disease had silently progressed for years before revealing itself through ascites. The presence of ascites usually means advanced liver damage and can lead to dangerous complications such as infections, difficulty breathing, and kidney problems. If you notice sudden or progressive abdominal swelling, especially if your legs are also swollen, do not dismiss it as mere weight gain. It is one of the clearest late warnings from the liver. Sign 5. Swelling in the legs and ankles. Closely related to abdominal swelling is edema, or swelling in the legs, ankles, and feet. This occurs when the liver fails to produce enough albumin, a protein that helps keep fluid in the bloodstream. As a result, fluid leaks into surrounding tissues. Patients often notice their shoes feel tighter, or their socks leave deep marks on the skin. Unlike normal swelling from standing too long, liver-related edema usually worsens over time and does not go away with simple rest. I recall an elderly man who thought his swollen ankles were just old age. He didn't realize it was his liver failing to maintain the balance of fluids in his body. Though leg swelling can also be related to heart or kidney problems, when combined with fatigue, jaundice, or digestive issues, it becomes a strong warning of liver dysfunction. The lesson is simple. Persistent leg swelling should never be ignored. It may be your body's way of signaling deeper organ failure. Sign 6. Nausea and vomiting. Another subtle but telling sign of liver disease is frequent nausea or vomiting. This happens because a damaged liver struggles to filter toxins and produce bile, leading to digestive upset. Patients often describe feeling queasy after eating fatty foods or even experiencing unexplained vomiting. Some may attribute it to food poisoning or stomach problems, but when nausea is chronic, the underlying issue could be the liver. I once treated a woman who said she constantly felt motion sick, even while sitting still. After tests, we discovered her liver was severely inflamed due to hepatitis. Chronic nausea can be exhausting and dangerous, leading to dehydration and further malnutrition. When accompanied by fatigue, weight loss, or abdominal swelling, it's a red flag for liver disease. If nausea persists without a clear explanation, it's time to look deeper. Your liver might be sounding the alarm. Sign 7. Abdominal swelling and fluid retention, ascites. One of the most alarming physical signs of liver disease is abdominal swelling, often caused by fluid buildup in the abdominal cavity, a condition known as ascites. This happens when the liver's function to regulate fluids and blood pressure in the body is compromised. Patients may notice their belly growing larger, even without weight gain, or feel a constant tightness and discomfort. In advanced cases, ascites can be so severe that it makes breathing difficult or restricts normal movement. I once treated a patient who thought his big belly was just from aging and poor diet. But when we performed tests, we discovered several liters of fluid pressing on his organs, caused by cirrhosis. Ascites not only signals advanced liver disease, but also increases the risk of life-threatening infections, such as spontaneous bacterial peritonitis. If you or someone you know develops unexplained abdominal swelling, especially when combined with jaundice or fatigue, it is critical to seek medical evaluation immediately. Early treatment can ease symptoms, prevent complications, and extend life. Sign 8. Mental confusion and memory problems, hepatic encephalopathy. The liver is not only vital for digestion, but also plays a major role in keeping the brain healthy by filtering toxins. When the liver fails, harmful substances such as ammonia can build up in the bloodstream and affect the brain. This condition is called hepatic encephalopathy. Patients may show subtle symptoms at first: difficulty concentrating, forgetfulness, or irritability. As the condition progresses, confusion, personality changes, or even tremors in the hands can appear. I recall a case of an elderly man whose family thought he was just getting dementia. But the sudden changes in his mood and memory were actually linked to advanced liver disease. With proper treatment, his clarity improved significantly. Hepatic encephalopathy is dangerous because it can progress quickly from mild confusion to coma. It is one of the strongest signs that the liver is no longer able to protect the body from toxins. If you notice unusual mental changes, especially in someone already diagnosed with liver problems, do not assume it's just aging. It could be a medical emergency. Sign 9. Easy bruising and bleeding. Another warning signal of chronic liver disease is easy bruising or prolonged bleeding from small cuts. The liver is responsible for producing proteins that help blood clot. When damaged, the body loses this ability, leading to excessive bleeding. Patients may find that even minor bumps cause large bruises, or that their gums and nose bleed more often than usual. Women may experience heavier menstrual bleeding. One patient I treated came to the hospital with massive bruises on her legs after just light exercise. She was shocked to learn her liver disease was the hidden cause. This symptom is dangerous because it often appears when liver damage has already advanced. It also puts patients at risk of internal bleeding, which can be life-threatening. If you notice sudden changes in how your body bruises or bleeds, don't dismiss them. This could be an urgent call for medical help. Sign 10. Dark urine and pale stools. Changes in urine and stool color can provide important clues about liver health. Dark urine that looks like tea or cola often signals an excess of bilirubin in the body, while pale or clay-colored stools suggest reduced bile flow. These symptoms occur because a damaged liver can no longer properly process bile, which plays a key role in digesting fats and giving stool its natural brown color. In one case, a woman noticed her urine turning darker over weeks, but dismissed it as dehydration. Only later, when pale stools appeared, did she realize something was seriously wrong. Tests confirmed cirrhosis. If urine remains dark even after drinking enough water, or if stools become unusually light in color, it is important to consult a doctor. Together, these changes often point to significant liver dysfunction. Sign 11. Skin rashes and itching. Persistent itching or skin rashes without a clear cause may also be linked to liver disease. When bile salts and toxins build up in the body, they deposit under the skin, triggering irritation. Patients describe the itch as deep and relentless, often worse at night. Scratching provides little relief and can even cause wounds or infections. I remember a patient who had been treated for allergies for months, but his itching never went away. Only after further tests did we discover chronic liver damage. Skin itching from liver disease is not just uncomfortable, it signals that the liver is overwhelmed and toxins are circulating in the bloodstream. If you or someone you know experiences unexplained itching for weeks, especially with other liver symptoms, it should not be ignored. Sign 12. Swelling in the legs and ankles. The final silent sign we'll discuss is swelling in the legs and ankles, medically called edema. This happens when the liver fails to regulate fluids and proteins in the blood. As a result, liquid leaks into tissues, especially in the lower body. At first, the swelling may seem minor, just a bit of puffiness after standing all day, but over time, it can worsen, making it hard to walk or wear shoes comfortably. One of my patients thought her swollen ankles were due to too much salt. In reality, her liver disease had disrupted protein production and blood flow, causing the edema. Though swelling may seem less urgent than other symptoms, it often indicates advanced liver dysfunction. Combined with fatigue, jaundice, or abdominal swelling, it is a serious red flag. If you notice persistent swelling in your legs or ankles, especially if it doesn't improve with rest, it is time to check your liver health. The liver is a resilient organ, capable of healing itself in the early stages of disease. But once the damage progresses, the warning signs become harder to ignore, and the risks become life-threatening. We've explored 12 silent signs of liver disease, from fatigue, jaundice, and weight loss, to swelling, confusion, and changes in urine or skin. Each one is your body's way of sounding the alarm. The challenge is that these symptoms often develop slowly and can be mistaken for aging, stress, or minor health issues. That's why awareness is so important. The sooner you recognize these signals, the better your chances of seeking treatment, slowing the damage, and even reversing it in some cases. Remember, prevention is always better than cure. Maintaining a healthy diet, limiting alcohol, avoiding risky medications, and getting regular checkups can all protect your liver. If you or a loved one has noticed any of these warning signs, don't wait. Talk to a doctor. Early action can save years of health and life. If this video has helped you recognize the silent signs of liver disease, please take a moment to like, share, and subscribe. By doing so, you not only support our channel, but also help spread this vital information to others who may be at risk. Your health and the health of your loved ones matter. Sharing this knowledge could make the difference for someone silently suffering, unaware of what their body is trying to say. And don't forget to turn on notifications so you never miss our future videos on protecting your health and living longer, stronger, and better. Together we can build a healthier community.